Hello, everyone. I'm Dr. Jonathan Mathis, and I'm a pediatrician here at Holzer.
Yeah, hi everybody. My name is Jason Newland. I'm a pediatric infectious diseases doctor up at Nationwide Children's in Columbus, Ohio.
Dr. Newland, thank you for coming down and hanging out with us, for agreeing to do this interview. I really wanted to, with everything going on right now, with the measles outbreak and the discussion and concerns about vaccinations, I thought it would be a really great opportunity to combine rural primary care, the infectious disease, the academic side, the studies, and to gain more knowledge to be able to speak to the community and to answer questions and to just work through this together.
Absolutely.
So I really appreciate you coming down here and doing this with us. Can you speak to just where we are?
Yeah.
With everything that's going on.
Well, Dr. Mathis, number one, thanks for having me.
Of course.
I mean, just so everyone knows, like I'm a small town kid, man. I grew up in Southwest Oklahoma, a town of about 20,000 people. I'd say middle of nowhere, but it was the best.
Right.
So being able to come down here.
Right.
Gallipolis.
There
Make
you
sure
go.
I say it
there
right.
you go. We practice.
We practice because
we practice for a
being
while.
From that, I mean, I think this is important, right?
Yeah.
You guys are my people. I grew and became who I am because of that, and I get to work in some great places and had great experiences. So I want the best for children everywhere, especially in places like Gallipolis. Where are we? Where are we with the world of vaccines? We've been through a lot in the last 5 years. I know where I was May of 2020.
Right.
I think all of us were in kind of somewhat of a denial of what was going on, and none of us would say that a few years later their lives would be upended, but I think most of us were.
Sure.
And one of the things I think was upended for us in the world of pediatrics and those of us who care for children on a daily basis, whether it's here in Gallipolis or Altus, Oklahoma, or Columbus, Ohio, or Kansas City, Missouri, all these different places that I've been blessed to be. We're all about one thing, is making sure kids' lives are better.
Right.
And vaccinations has been one of the ways in our country to make sure our children's lives are better. Right. So we know that there's a lot of angst, one might say, or concern or fear that our parents, our families have with sometimes given vaccines.
Right.
Because they've heard a lot of different things. And man, nowadays, we can look up all kinds of stuff.
Yeah.
At our fingertips is information. That information is power. But sometimes that information might argue is powerless.
Right.
And takes away from what I think we're all after, which is the best for kids.
For sure.
And I think the state is, as of May 12th, 2025, is we have over 1,000 cases of measles that have been confirmed in the United States, most cases we've had in 2 decades. We know that can be impactful. We've had 2 children die this year of measles. That's just one of the vaccines, right? One that we are talking about the most. We've had the largest pertussis outbreak in over 10 years, right? Throughout in the last 2024, 2025. Wow. We've had the most influenza deaths in children this year.
This past season.
Past season, many would say, I'm sure you thought, I know all my colleagues have thought that, man, this was a really bad influenza season. What people forget was in 2023-24 season, we had 207 deaths. First time we'd eclipsed 200 deaths in children. Now he says, well, it's only 200. I'm like, it's 200 kids.
Yes. Those are 200 lives, families changed.
Hurt. But again, I'll go back. I think that's where we are, and I think we know there's a lot of people that are struggling. What's the right thing to do? I want the best for my kids. Is the vaccines the best for my kids? Of course. I, growing up in small town America and with a dad who told me what it was like standing in line for his polio virus vaccine. You know why he stood in line? He's like, Jason, it was so exciting because now I was going to get to go to the swimming pool in the summer because his mom wouldn't let him go to the swimming pool in the summer. Why is that? Because that's when you had outbreaks.
Exactly.
That's when you saw kids that then all of a sudden couldn't use a limb, or they had to be in a machine that would breathe for them, the iron lung. Like we don't know that.
Right.
And that's that generation, that baby boomer generation remembers that. My colleague next door, Dr. Bill Barson, remembers having measles. You and I don't know what's that like. We got vaccinated.
No. I had chickenpox.
I did too.
I did have chickenpox.
And chickenpox
I remember
was
chickenpox.
rough.
Yeah, that was.
So I think where we are then, just simplify because I can chat all day.
Sure, me too.
Right? Is we're at a point where we got to listen,
Yeah,
we got to support,
right.
and we got to advocate
Yeah,
for what's best for our children. We got to work with all of our families
yes,
to get to what's best for our children. And I'm going to go on and say it's vaccines.
right. And and let me just say from the outset, this is to spark conversation.
Yes.
Like we've spoken off camera. This is not to ridicule.
Nope.
This is not to make people feel bad about certain decisions that they make. An approach that we take, and I take personally, is if a family comes into the office and there are questions or concerns about a said vaccines, putting MMR, measles, mumps, and
Yeah.
rubella to the side. Sometimes it's I'm not against vaccines, or before you say anything, we're not going to do that. I said, listen, I'm not a salesman. If I had to be a salesman, I would be the worst salesman in the world, okay? Because I talk way too much and I get off topic, right? But besides that, it's not about. It's really to have the conversation of what questions can I help to address for you. What are some of your concerns? What are some of the things that have made you feel a particular way about vaccinations? I want you to have all the information from whoever, friends and family maybe, that's fine. Let me give you the other half.
Yep.
What you decide to do after that is ultimately up to you. I have children too, right? So I want to feel like, that we are doing the best for our children.
Yep.
So that is the biggest point. And I also tell families, I want you to push me. I want you to ask me the questions. I want you to challenge me on why we're recommending the safety, so on and so forth, but also challenge those who are giving you the other side.
That's exactly right.
So I want you to have all the information. So that is the point. That is the purpose of this interview right now. It's information. That's it. So I completely agree. And with the measles outbreak, we said we're a little over 1,000
Yeah,
cases
1,001
right now.
as of May 8th, 2025.
The children let me ask you. You said you had three deaths, and 2 of those were children.
That's correct.
Were they vaccinated? Were they partially vaccinated? Unvaccinated? How does that play
What
out?
we know, we don't know specifics, but they're either unknown or unvaccinated.
Okay.
So we know there's no confirmation that they were vaccinated.
Okay.
The data that we have over the years has been that anytime we've had measles, they've been unvaccinated for the most part. Now, we know that if you receive 1 dose of measles, mumps, and rubella, you're 93% effective.
Right.
It's 93% effective. If you get 2 doses, it's 97% effective. So, right, that means it wasn't 100%. So if you get 100 people vaccinated, there's a chance that 3, if they all had 2 vaccines,
Right.
3 could get it. So that's still within the norm. But of those who have died, it looks like they haven't been vaccinated.
Okay. Do you think vaccines have done too good of a job? And what I mean by that, are they a victim of their own success?
100%.
And the fact that measles has returned, there still may not be a sense of urgency.
Correct.
Because we didn't talk about measles for so long
100%.
because we had that protection. What do you think that general attitude is due to?
Yeah, I mean, do you like sports?
Yes, it depends. I'm a Jet and a Knicks fan,
Oof,
so
that's
it
rough.
is. So
Think about the left tackle. The super successful quarterback, right? When they're just crushed, like Patrick Mahomes, one would argue like one of the best quarterbacks, right now. He did terrible in the Super Bowl, right?
Yeah.
Because the left tackle was a disaster.
Yeah.
But you don't talk about the left tackle when Patrick Mahomes is just crushing it, right?
100%. 100%.
So I'd say, yeah, we're a victim. Vaccines are a victim of their own success, right? We don't talk about a child coming in your clinic or come see me in infectious diseases not using one of their arms because they have polio.
Right. Right.
We don't talk about measles where a little baby who maybe got measles 8 years ago now shows up in the hospital because they're loopy and they're not acting themselves, and then they go on to need the ICU, which is something called subacute sclerosing panencephalitis, a lot of words to say that's a really bad neurologic complication. Measles. We don't talk about that because we don't see that.
Right, 100%.
So yes, we are a victim or our vaccines are a victim of that success because when you don't have to deal with it. Wait, look at what happened with COVID.
Right.
When COVID was rip-roaring through all of us and our families, I did COVID vaccine trials. We did randomized controlled trials of COVID vaccine in 6 months to 11 years of age. We put out this big sign, hey, we're going to do these trials. You know how many kids I had signed up to want to be a part of that trial?
No.
10,000.
Yeah. Yeah.
Because COVID was rip-roaring. And we know that even in West Texas, their vaccination uptake for measles has gone up.
Yeah.
Because it's right there, because now you experience it.
Wow. So it takes calamity sometimes, right? It takes bad things to happen, right? So in order to get the ear, right? Because there's still going to be people who don't feel comfortable with doing it, and then we're hoping to address a lot of those concerns with what we're at least beginning the conversation, right?
Yeah.
So what is measles? You know, what is it something to be worried about? You know, you mentioned SSPE or subacute sclerosing panencephalitis.
That's money that you just pulled that off like that with a guy that doesn't talk about it all day.
You know, listen, I try. I
Strong.
did practice. Mirror time. It was practice. Okay.
I have trouble with that one.
Okay. So,
Sorry.
you know, but in all, and seriously, you know, how severe is it?
Yep.
How bad is it? What can come of it?
Well, all right, so I'll just say this. In 2023, 109,000 individuals, predominantly children, died of measles around the world. Not in the U.S. 109,000.
Wow.
Is it bad? Yeah. Oh, yeah. Now, you can say, well, maybe these are in developing countries and they don't have some of the infrastructure. 100%. But that's how bad it can be. It's not a runny nose and cough that leads you to go home and be fine.
Starts off that way.
It starts off that way.
Right.
But that's not how it can end. Right? And back before we had vaccine, you're talking 500,000 cases a year.
Right.
You're talking 4,000 having impacts on their brain.
Right.
Being admitted to the hospital. You're talking a couple hundred, I think they said 300-400 deaths a year in our country in a society that had a lot of stuff.
Right.
So measles is a virus. Right? There is no antiviral like Tamiflu for influenza. There is no antiviral directly to measles. We know we can give vitamin A to help to alleviate maybe some of the severity, but there's nothing else to treat it. There's no antibiotic. Clarithromycin does not work. But yeah, measles is a virus that's really bad, and it contagious as all get out.
So talk more about that. You know, how contagious is the measles vaccine, and what are some of the complications or other illnesses that can result from it, aside from the runny nose, cough, red eyes, so on and so forth?
Yeah. All right. So from a contagiousness state.
Okay.
So it spreads airborne, right? Those little droplets that can get up there. It is so contagious that if our wonderful, awesome Dr. Mathis has a patient that he sees in his clinic, and he's like, oh, this is measles, and everyone's like, oh yeah, this is measles. He cannot use that room that patient was in for 2 hours. He has to shut that room down because anybody that has susceptible goes in that room, they can get measles. It's that contagious.
Wow.
It's so contagious that if one individual has measles and comes into a room with a bunch of people that all could get it, right? None of them are vaccinated. 18 people. One will get it, right? Versus COVID, because we all just experienced COVID, where it was 3 to 4.
Right. And then multiply that with each person who gets it, and then that's
it just keeps
exponentially.
going. Hence why that vaccination rate being over 95% is essential.
Right.
So other people don't get it. So that's the contagiousness. What about the complications?
Right.
Pneumonia is the big one.
Is that the biggest one you see?
The big one is the pneumonia. You get bad pneumonia. That's what's probably impacting the most deaths around the world, is pneumonia. But I worry about the brain.
Right.
And I worry about the little ones, the babies. Babies get measles and they're at risk, the highest risk for subacute sclerosing panencephalitis, a fatal neurologic condition that occurs 7 to 10 years later. That's absolutely so cruel to have a child normally develop and then die of something that we could protect them from.
And you won't know what the cause was unless you have the history.
Yep, and you have to be thinking about it, because you imagine something happens 7 to 10 years later,
Right.
you're not thinking it.
Exactly.
Now, that's on the rare side, but it scares me to death.
For sure.
But there's also just acutely, meaning right there within that 2 to 10 days of after getting measles, you can just have brain impact and have what we call encephalitis, inflammation of my brain, leading to bad headaches, acting not themselves, and it will get better, but that's still significant.
Yeah.
And who wants to see their kids struggling neurologically? It is scary.
Right.
So I think we underestimate, to your point, you know, victim of our own success.
Right.
We underestimate how bad this virus is because we don't see it. And I think you've done such a great job of kind of that discussion, right? I get these runny nose, coughs, red eyes.
Yeah.
Looks just like a lot of other colds.
Right.
Well, it sure does make life difficult if there's a lot of measles running around a community. Now we're all scared, right?
Right. Right. So then what does that look like? Because it can look like everything, and everything can look like measles. So what can families look for?
Yep.
And also even for practitioners, right? You know, when you're and we're kind of like, could be, is it, you know, and the travel history may not be the greatest, and as it spreads more and more, it comes closer to home. So what are some of the things that we should be looking for?
Yeah, the big things is before the rash, you'll have fever and the 3 C's, and those C's are cough, coryza, or as many of you know, runny nose. Right. So if those aren't in healthcare, coryza we call that runny nose. And conjunctivitis, or the redness of the eyes. Usually both eyes are bright red, like the whites of the eyes are red. Those are the 3 elements. But that's before the classic rash, and that usually comes about 2 to 5 days before you get this rash that shows up on the head, typically behind the ears, then can be on your face, and then spreads down your trunk, down your arms, down your legs, and it's kind of raised and red. Not typically thought to be itchy, but you never know, someone might itch. But that's the classic. Now, the issue is, right, you're contagious 4 days before you have the rash, and then 4 days after you have the rash.
Right.
And from the time you get exposed to the time you get these symptoms can be as long as 3 weeks.
Wow.
Which is quite annoying.
So you don't know what's going on. You don't
You're
know.
not right, you don't know.
You don't know. Yeah.
So I think to that point, right now, because we don't have a lot of measles in our country, we use that next thing you mentioned, which is where you have been.
Right.
But that gets harder if everywhere in the country is experiencing measles, because then we're now having to think, oh, you were here, oh gosh, there's measles there, oh gosh. Right. And so now, because this looks like all these other viruses a lot, makes it hard.
It's kind of like that question when families come in, their child is sick, and you ask them, and it's the middle of winter. Have you been around anybody who's been sick? Well, it's everybody. Everybody's sick, right? So it's kind of, it becomes very, very hard. So once that rash begins, and it starts from head down. Yep. And does it resolve in the same fashion? And do I need to see the rash in order to do that? And, you know, and also the little, the spots in the mouth, the complex spots that we are all taught about, you know. And, but families, people might miss it.
They might miss it. I mean, I think that's hard. The rash is pretty, I think, striking to people. Yeah. And that's usually, now I think it resolves kind of over those 4 days, 5 days afterwards. I don't know if it resolves head to toe. Thankfully, I've only seen 2 cases. Okay. And by the time I saw them, that rash was kind of fading, and they were just sick in the hospital with pneumonia. Okay. And so I think that's a challenge, right? Right. You have to take all this, and we know that this 1,000 cases in the U.S. is probably an underestimate, because there probably was a number of kids that had colds that had this rash that never showed up in healthcare. Right. And that's why every time they renew the reports, it's going to jump. It's going to jump. I keep hoping it'll not jump like it has.
Right. But. Right. You mentioned vitamin A as a treatment to lessen severity. Does that mean that if I take more vitamin A now, let's say vaccinated or not, or if I start stocking up on vitamin A and I take it, does that prevent me or lessen my chances of getting measles? Now, it's different being vaccinated versus not being vaccinated, or even, you know, just one. If in the case of not being vaccinated.
Vitamin A does not. Okay. Vitamin A does not prevent measles. Okay. Vitamin A helps you not have severe measles disease. We know that in developing world, malnourished have worse outcomes. We also know that in hospitalized patients, they do better getting vitamin A. I think it's super important to note that you give too much vitamin A, you can have toxicity from too much vitamin A, and that has been seen in Texas.
Wow.
They have seen kids come into the ED where they've been trying to give vitamin A as prevention, and they've had toxicity. It's not a preventive, and actually we only recommend 2 to 3 doses if you even give it at all,
Right.
because of the toxicity.
And what does that look like?
The toxicity can be liver injury as well as kind of this peeling skin.
Okay.
Is the stuff that I remember.
Okay. Okay.
I haven't seen it. I don't want to see it.
So there is no treatment. There's supportive care
Yep.
and treatment of any secondary complications
Very
that may
good.
come with it, right? So that's the important
Yep.
aspect. And because ear infection, pneumonia, we
Yep.
talked about the
You
know,
should be an
first-
ID doctor. You know that?
You know, I tried at one point, and I tried to remember all the bugs in the classes and everything, and I just said, you know, I don't think this is going to work.
That wasn't for you?
I have my main classes, and I
Yeah.
remember those, and I stick with it. And if I go to the
Man.
red book, I
If
go to the red book if I can.
If I had you back then, you'd be an ID doctor.
I-
You speak like you're an ID doctor.
Well, listen, I'm interested and I'm passionate about things that just, and it's in our environment. We have to.
Well, the Gal
coexist,
Police
right?
people are lucky to have you guys, right? Come on.
Well, listen,
that's 3 times I've gotten
Listen,
it right.
It is. You know what I mean? You were really good, and I will say the entire team. You know, our whole P's department from staff meeting patients. You know, as soon as they come in, to the nurses, to the physicians, nurse practitioners. I think we are set on taking care of the community.
Yeah.
And because that community goes out into
Yeah.
a bigger
Yeah,
community.
that's right.
So once again, so that's a passion shared, you know, by a lot of us. But let me ask. So we talked about where we are with the outbreak.
Yep.
We talked about treatment and what we can't prevent with using with vitamin A and things like that. So what is the best way to ensure that a child does not get the infection of measles?
Vaccine.
Okay.
Right. The MMR vaccine is the best
Okay.
for prevention of measles. 2 doses. A dose given at 12 months, 12 to 15 months, and a dose given at 4 to 6
Okay.
will give us 97% effectiveness.
Wow.
And that you and me, actually, how old are you? 40. Oh, I'm
No,
not allowed
I'm
to
40.
say that.
I'm
Oh,
40. That's
we'll
okay,
cut
Joe.
that. We'll cut
No.
that. Anyway, we would have only gotten 1 dose,
Yeah. Yeah.
but most kids now get a 2nd dose because of an outbreak of measles between 1989 and 1991.
Does that mean that the first dose doesn't do the job, or was the second dose to ensure the response that the first dose that actually happened?
You said that perfectly. The 2nd dose was to ensure
It's to ensure.
the
Okay.
response. It's not a booster.
Okay.
Just ensure the response.
Okay.
It can be given early, so you can give it, 4 weeks after the first dose if you want. But right now we're fine with just giving it that second. But that super effective, right?
Yeah.
Super effective, and it has been, right? In the year 2000, the United States was considered eliminated from endemic measles disease, meaning our only cases of measles had originated coming from international travel.
Right.
Right. So it's not circulating through our communities, and you had to come from somewhere and to bring it in. So we've had cases, right? But we had to see, and then it might spread in an unvaccinated community.
Right.
And you being from New York City, one of my really dear friends just wrote a book called Booster Shots about, I think it's the 2018-2019 New York City measles outbreak among one of the Jewish
Yes,
communities,
yes,
right? Like that,
yes.
like we're seeing this midnight. It's this
Yep.
this sort of notion. So there's some cool historical stuff within those books and others.
Okay. Okay. But that's for those who can receive it.
That's right.
So what do we do for the children who are not one, who are under 1?
Oh man, perfect. All right, so right, like I said before, I worry a lot about the babies, right? Those 0 to 12 months. Obviously, you can protect them by making sure everybody around them gets vaccinated. That's one, right? If mom's vaccinated, that's going to provide some protection to the baby, especially in those first 6 months of life. However, we can give a dose between 6 months and 12 months of age.
Okay.
If there is an outbreak setting, like, so if you're in West Texas right now and you're in this Gaines County where the outbreak started, you're giving measles vaccine to those less than 6 months to 12 months of age.
Right.
Let's say like you're a 2-month-old and you've been exposed to an active case of measles. We can give antibody, so immune globulins, which we called it. We can give them that for some protection as well.
Okay.
So there is strategies we have But the best strategy is to make sure everyone's vaccinated around it. Now we're going to protect those babes.
100%. And a lot of the questioning is, my child is 6 months, they're 7 months, so on and so forth, right, between that time. Should I give my child that dose 0, like that first
dose
first
0? Again, another ID term.
Listen, let me tell you something.
I love this.
A little bit of reading goes a long way.
So in current time in Ohio, whether you're in...
That's for all the kids I tell to read.
You tell them to read?
I'm always telling the kids, are you reading?
You should read.
And for my kids too.
Oh, wait, what's your last book?
And for my kids.
What book did you just finish?
Oh,
you like how I just...
No. So honestly...
What are you reading?
So right now, I do a lot of audiobooks.
Oh, yeah. What do you... That counts. I think that counts.
So the book that I'm reading now is 400 Souls.
Oh,
and
that sounds impactful.
And before that, Stamped from the Beginning.
Oh.
And that is
let's go.
Yeah, that's
That's some heavy stuff. I like this.
It is. For another episode, we'll do that. But yeah, I get off topic. I told you I could talk. I always tell my kids to read. I'm always challenging to read. So this might buy me a little bit of credibility. Just say, I said it even outside of the exam.
Well, for the kids, I'm my youngest daughter, who's 19, and one of her friends, we're reading a young adult novel. And I just finished a book called Caraval by Stephanie Garber. Kind of fantasy and mystery and thriller. It was good.
Okay.
I just finished it last night on my plane ride back to Columbus.
Sweet.
It's fantastic. Sweet. Okay, but to your question, which was dose 0.
Yeah.
6 months.
Should we give it?
In Ohio, in Gallipolis, Ohio, Columbus, Ohio, Toledo, Ohio, anywhere in Ohio, no. We do not need to be given dose 0 before 12 months at this time.
Okay.
We do have cases in Ohio. We've had 36 cases as of 1st of May. But they're in Knox County is probably the closest, really, I think, county to Gallipolis.
Okay.
This
that's still quite a bit.
That's close to right?
Yeah,
so I think this is where we really are privileged to have public health. Right?
Sure.
So public health will continue to work with Ohio Department of Health and the local public health agencies to help us decide if we ever have to give dose 0. But right now, no. And I'm actually thinking on the half full side, we're going to get more people vaccinated and we're going to not need to do it.
That's the goal. And at least to have the uptick of conversations.
100%.
People come in and have conversations.
Yep, more conversations.
To challenge, to push a little bit.
Yes, I love it. Let's go.
To push a little bit.
Yeah.
How long is that incubation period, though? How long can I go without seeing symptoms? So 36 could be 136. It could be 336. And there could be people, listen, we're in summer months. People are traveling. We're on planes. We're in pools. We're going to the movies. We're going everything. And my child, they may not, listen, I got another 6 months before we can get that 93% of safety.
Yeah.
So what do we do?
Yeah, no, I mean, I think, there's obviously people out there watching this right now. They're like, man, I don't know, man. Should I go? I'm going to go. Like, if you're going to travel to an endemic where the outbreak is, one might say, raging, like West Texas.
Sure.
Yes.
Okay.
I'm giving it for that group. But there's no definitive from the CDC about domestic travel, who should get it. You can go to the state sites, right? So if you're going to Kansas, you're going to West Texas, they're recommending if you're 6 to 12 months, get it. Yeah. I want to say if you're going to stay in Ohio right now, you don't need it. The issue is, you say, well, why does it matter? Well, the issue is that the babies don't respond as well.
Okay.
Right, so if you get it before 12 months of age, they're not going to respond as well. So they will need 2 more doses in addition to that dose 0 that you so correctly stated.
So if they get that dose at between 6 and 11 months, what does that do to the 1 year and 4 year vaccine?
They still should react and respond correctly, but they need to get their 1 year shot for measles, mumps, and rubella, and they still need to get their 4 to 6 year shot for measles, mumps, and rubella.
Hence the point, the need for that second dose.
That's exactly right, to make sure we continue. Yep.
In your opinion, what do you feel is part of the I guess what's feeding or what ignited this questioning of a medical intervention, if you will, of that has saved millions of lives over the courses of decades.
So if you just look at measles vaccine, since 2000 to 2023, the estimate is that has saved 60 million lives. 60 million.
That's it. Just 60 million.
60 million, right? Like
that's a lot of people.
That's a lot of people.
That's a lot of people.
Lives are saved because of a vaccine. Right. But that's not me trying to duck the question. What is it? Well, look, we have information at our fingertips, as we talked about.
Okay.
And so we can get a lot of information, and knowledge is power.
Yeah.
Knowing is power, right? So, and we all care about our kids, and we all want to do what's best for our kids, and we want to control that.
Yeah. Yeah.
And so now we can get a lot of information, and we can hear a lot of scary things.
Yep.
Right? Autism.
We have to address it. Right.
We have to address autism. Medical paper published in one of the leading medical journals in the world called Lancet in 1998.
Mm-hmm.
Basically says, hey, we think there's this association between MMR and autism.
Mm-hmm.
The study was 12 patients. The study was looking at and the parent says, I think this was associated. Mm-hmm. And it was funded by lawyers.
Yeah, it was.
And
he was a physician.
then it was retracted.
Yeah.
In 2010.
Yeah. Why was it retracted? Because sometimes I will get into the conversation once again, and families are like hand on the door trying to get out, and I'm just trying. But let me just say one more thing. But why was it retracted? Because I think that's the big issue. Because there were claims being made, but was that information true?
Yeah. So it again was based off of speculation.
Right.
And so conclusions were based on speculation with only 12 patients, which is so understudied. And frankly, since that point, there's been 1 million probably patients involved in looking at this association between the vaccine and autism. It's just not there.
Right.
Study after study after study with large data sets. And I think, again, people are going to be able to push back and all this, but the fact that it was published with 12 patients is just absolutely crazy. I mean, there's nothing there.
Yeah.
And then it's been shown over and over, and I think
it's been studied.
And it's been studied over and over. And look, this is the hard part. It's not easy, right?
Yeah.
Let's be clear. Statistics is not easy.
Yeah. Yeah. No, it is difficult, and that's why, once again, it's the conversation.
Yep.
It's the information that is out there.
Yep.
There's a lot of information, and I've always said, if you're on the fence and you are with anything, and you're concerned, and especially when it comes to your children or for children that you care for,
yep.
You are living with a decision that is going to impact them long after we're gone and we're not here and they moved on.
That's
right?
exactly
So we
right.
want to make sure it's the right decision. Anything that pushes them over that fence to a stance of, no matter what they're telling me, I don't want to do it. That fence, that it grows another 100 feet.
Yeah.
And it's hard to get back on the fence and to get there, right? Yeah. So it's really just having that conversation to say these things.
Yeah. The beauty about the conversation, though, is that we actually agree on the essence of the conversation, which is we all want what's best for the kid.
Right.
That's what it's about. I mean, we're having the conversation, and at least we're all agreeing that we want what's best for something.
Yeah.
The true north is still there.
Yeah.
It's just making sure we remember that we're actually after the same thing.
Exactly.
Which is what's best for the kid.
Exactly. But it's inviting the conversation.
That's exactly, and having it. That's why I'm just so excited to be talking about this in this way.
For sure. And there's still going to be, and listen, this is not something that is going to be solved in a week or a month or whatever. We're going to have to continuously have this conversation.
Yes.
Continuously lean on the medicine to challenge what it is. Science is only as good as its last, proof.
Yep.
Or so we're always going to constantly have to go back to the drawing board to ensure that we are doing what's right.
Yep. And I think, look, I mean, we go to the MMR, right? I mean, I think the science has been clear.
Yeah.
That it's a safe, effective vaccine.
Right.
And we've had some step backs where people are questioning that, but we can go back. That science has been clear.
Yeah.
And we just have to keep having that and listen to people. Let people talk about that.
Yeah.
And make sure that we're understanding each other.
Sure.
And so I think that's still going to be important for us to, that bedrock or that foundation of science when it comes to MMRs, it's
100%.
Solid.
Yeah, and I guess because I wanted to pivot a little bit,
Yeah.
but I think the last thing, and we could talk about this for
well, we could have you guys. I hope you grabbed your popcorn and candy and.
Right, but the herd immunity.
Yeah.
We are at a point where
it sucks.
we are below the threshold of what it would take in order to keep those who are not vaccinated safe from a particular virus and or bacterial illness too.
That's true, because
right?
that comes next. Yeah.
It does. So, what's the danger of that, and where are we? What are we heading in? The right direction, the wrong direction? Have we plateaued?
Wrong direction. All right. So if you look at 5-year-olds, national data, and what's the percentage of those having MMR, the measles, mumps, and rubella vaccine? We know that 95% above, so it's necessary to basically keep us at avoiding epidemics of measles, right? Like that we can not spread throughout our communities.
Right.
The most recent publication looking at 2022, 2023 suggested nationwide we're at 92%.
Okay.
Right? So we're 3% below, and we were at 93% before
So
that.
it's supposed to be at 95%, right?
If we look at Ohio specific data,
Right.
89%.
Wow. Yeah.
So if we look at different counties, I mean, I think we can all guess there's probably some counties that are even lower.
Yes.
Especially, this is data coming out of schools, both private and public schools. So if there's a group that might not even be represented in that data, it might even be lower. So point being is, yeah, we're under, right? We're significantly under. So I think that's the concern. While we have these outbreaks that started in a community that is known not to vaccinate because of that mistrust,
Right.
But it can get into these other areas where there's a lot of other folks.
Right.
You don't get that protection,
Right.
Before we might have a community of non-vaccinators, but we protected around it so it just stayed within that community.
Right.
Now we got too many pockets.
Right. Right.
And, a lot of pockets end up into one big hole.
Right.
In
And it's
the end.
right. And once again, decisions that are made. Once again, we got to talk about it.
Yep,
And
100%.
in the end, if we're just we hope for the best, and we hope that we keep that door open, keep that line of communication open, and we don't know what that may. They may not come to that decision to vaccinate today or here, but perhaps if it's somewhere else later on, if one conversation can spark something that may take a little bit of time, well then it's all worth it.
Yep, 100%.
If I can pivot to another vaccine that I feel like has, or I will say vaccine preventable illness that is of a little bit of a hot topic is Hep B.
Oh, yeah.
So we get hepatitis B through certain behaviors, certain risk factors, right? Bodily fluids. Sometimes it might be in somebody who is, IV, intravenous drug use, or there's a myriad of things that may be associated with later on.
Yep.
Right. Why is it important for that? Because it's always that first vaccine, right? That is a little difficult to get. Sometimes some parents to agree to. What would you say in those cases of, well, you know what, mom's vaccinated, my child is newborn, they're not doing those certain things. Why would they need that first dose?
Well, first off, hepatitis B is also very contagious. It's one of those things that it can lie around on a surface in a bathroom, and it's the one that you can get. Right? It can be on for a week.
Wow.
All right.
So it can sit on the surface for a week.
Yeah, and you can still get it, right? Like this is the
it.
one I remember in reading the Red Book from my board.
Yep.
So I was like, oh man, hepatitis B, you do not.
Right.
You be vaccinated. So like, let's say that you want to go into healthcare. Well, of course you want a hepatitis B vaccine, right?
Right.
So there's that. There's also the risk of liver cancer.
Right.
When you get this. So like, it's such a, and again, it's the same notion. Like if we don't have a lot of hepatitis B in our community, then we have to worry about this contagious disease. So it's just so simple, and it allows for everyone. Just right now, if we look at hepatitis, there's a hepatitis A outbreak in California.
Right now, at this moment in time.
At this point, just emerged.
Yeah.
It's been going on since 20. I mean, your liver, you have one of them. You don't want liver failure,
Right.
and so it's just been such an effective vaccine that we don't talk about hepatitis B because we never see it.
Right.
So to me, it's just, and there's no side effect. I mean, there's hardly, you don't see any. You've been given hepatitis B in babies for a long time. It just happens, and they move on, and it goes. I think the downstream impact is tremendous.
Right. And I think that's a key point of, yes, there may not be, quote unquote risk factors that the newborn is engaging in, of course, right?
Yeah.
But that doesn't mean that it cannot be in other places that they will be susceptible to, should they be picked up and then touched and in the face and all.
Yeah, where you work, in the healthcare environment, all these things. I mean, and actually, if you were exposed, it also give you protection. I mean, there's so many reasons.
For sure.
And I mean, the benefits are just tremendous.
Yeah.
Just tremendous. It's like if I was to bring up the one that I like, human papillomavirus vaccine, HPV.
Yeah.
Like that vaccine is ridiculously good. Let me just be clear. Right?
Yeah.
Like, like it is so good at preventing cancer. I mean, cancer. I mean, we're talking cervical cancer in women, penile cancer in men, right? Like it is unbelievable that there's even, I've read something, I haven't seen it confirmed, that women that receive HPV vaccine, they might not have to do their annual screening because it's that effective at preventing cervical cancer. Like that's crazy, right? Like that, like I call it the creme de la creme. I mean, like the vaccine that everyone should be getting. You should please just get this.
Right. But still go see your OB/GYN as well.
100%, yeah, 100% go see your OB/GYN, but get the HPV vaccine.
Right.
They want that too.
For sure. And a lot of the concern is, well, how do we get HPV, right? It's contact, intimate contact, and those kind of things, right? But it's not a if you'll get it, it's a when. Because
100%.
you don't know if you're going to clear it or not, right? So that's another conversation that we have, especially at in those teenagers. And I put my money, put my money where my mouth is. That old cliche of a saying. That's kind of terrible saying that out loud, though.
That's right. You're getting older.
You have to scratch that.
You're getting older.
But my kids, my son he's 11 and just had him in. Went to go see Dr. Mary Sperry. And he loved his visit. Him and my daughter Riley, and. He had his visit. He was 11, and he got his HPV.
Good for him.
HPV, Tdap, meningococcal.
Go.
So I would never, and that's the other thing too. It's that sometimes it's the perception of recommending, which is why I always will say I have also done this. Well, I believe it so much that I have my own children, my pride and joy. Right, our children. I brought them in. And
all three of mine got it all.
You are involved in a number of different projects.
I like
a number of different things.
I like to do things.
Okay. Like to do.
I especially like to talk.
But me too. One of those is antimicrobial stewardship.
Oh yeah.
Can you explain what that is and what the significance of that initiative?
Yeah, I mean, okay, so what does this mean? So we need to use our antibiotics that are, these medicines that treat bacterial infections, but they also can treat fungal infections. They can treat, parasitic infections like malaria, right? So this is super important. I call it the silent pandemic. If you look right now, we have about 30,000+ individuals in the United States who die annually from an antibiotic-resistant infection. Okay, so
are we talking about common infections not responding to a host of antibiotics, or are these more complicated situations, rare infections?
Both.
Okay.
Right? So everyone's heard of MRSA, right? Methicillin-resistant Staph aureus, right? Can cause skin infection, but it also causes bad pneumonia. Cause your bone infections, cause your heart to get infected, all kinds of things and stuff like that. It could be, these other bacteria that cause, urinary tract infections. Wow. It could also be that here's the story I always tell. Yeah. All right. So if you have a child that gets leukemia at the age of 5, right? Scary, right? What's their chances of survival in this day and age, standard risk 5-year-old with cancer in 2025? Probably 98%. Wow. Right? So in 1950, that wasn't the case. Right? But what happens if they get a bacterial infection, because they have to have one of these central lines, right, that goes into their vessels and it goes in there, and they get a bacterial infection that's resistant to every antibiotic, and they come into the hospital in what we call sepsis, where they're looking sicker than stink, and we all know what that looks like. Yeah. And we don't have the right antibiotic, and we don't pick the right antibiotic. They can die, right? So now they're dying of something that we eventually occur. People don't realize, right? Like C-sections, right? That used to be really scary, sort of. It's an operation. Right. Antibiotics have helped prevent those, right? The reason why we can do transplants, lung transplants, liver transplants, kidney transplants, heart transplants, because we have antibiotics. And we can do all. I mean, so it's like, well, yeah, you're like, is this? No. These allow us to have modern medicine. And we have modern medicine. So here's one quick historical story. Calvin Coolidge Jr., right? Son of Calvin Coolidge, president in the 1920s. June 30th, 1924. Right? So that's just over 100 years ago. That's not that long ago.
Right.
Playing tennis on the on the White House lawn, barefoot. By the way, you can go read this story. This is true. Playing barefoot, scrapes up his big toe. A couple days later, it's infected. There's no antibiotics at the time. June 30th, 1924. He dies. Calvin Coolidge Jr., as a teenager, dies on July 7th, 1924. People said that changed history. Calvin Coolidge wasn't himself. He went away and he traveled away.
What was the infection?
They think Group A strep or Staph aureus, right? Think about this. Think about you had one of your. I'm sure one of your kids has had like a skin infection.
Yep.
What'd you do? I gave him Keflex. I had a daughter that had bad old orbital cellulitis.
Yeah.
Had infection behind her eye.
Wow. Yeah.
What happens if she doesn't have antibiotics?
That's a problem.
So point being is that these have changed medicine, just like vaccines.
Sure.
And now data would suggest, worldwide data, which brings in all kinds of stuff, that by 2050, we'll have 11 million deaths around the world due to antimicrobial resistant infections. All kinds of things. Tuberculosis, malaria, routine stuff. You can say, well, that's not obvious. Well, some of it will be obvious. So what antibiotic stewardship then is making sure that we use antibiotics correctly. I'm not saying we don't use them. Again, revolutionized healthcare, right? So what we try to do is give the right drugs, the right antibiotic, at the right dose, for the right duration of time, right? So an ear infection, right? I get a 4-year-old here with an ear infection. I want to convince you guys to do 5 days now, not 7.
Right.
We have more data coming out suggests that should work.
Used to be 10 days.
We have data now that says if I have a kid that's 3 that comes in with pneumonia, which I'm like, oh, that's definitely bacterial pneumonia, 5 days.
5 days.
That's all you need.
Oral antibiotics.
Oral antibiotics, 5 days. This is antibiotic stewardship, right?
Right.
Picking the right drug, giving them the right dose, giving the right dose, and sometimes timing, right? Making sure I give it when it's supposed to be given.
Right.
So like if you have some person come in that's super sick that we think is septic, we give it sooner rather than later.
Right.
Preventing surgery infections, surgical site infections, right? You have surgery. We know that we have timing matters, these sorts of things.
Right. So how does that tie into decreasing vaccination rates? Decrease
dude, right here,
herd
come on.
immunity, and antimicrobial resistance.
I love this.
Because we're in that viral
I
realm,
love it.
But what if we're in the meningococcal, the strep pneumo,
Just come on, keep talking.
the Hib?
Yeah.
I mean, what does that look like?
Oh man, so many things to say right now. You're just making me happy. All
Okay.
right, number
Well,
one.
yeah.
Why does vaccine link
today,
with
man. I made 'em happy.
vaccines? Here we go. So for example, all right, so there's this amazing vaccine called Streptococcus pneumoniae conjugate vaccine. We now are up to 20 serotypes, meaning that this bacteria has 20 different versions of themselves. Think of 20 cousins, right? We can think of it that way. So we now have a vaccine that will prevent these from causing infections. That's a bacteria. That's the most common cause of ear infection, most common cause of pneumonia, most common cause of having meningitis, right? Bad disease that, guess what, if you get it, guess what we have to do?
Yeah.
We treat them with antibiotics.
Yeah.
If I don't have to treat with antibiotics, then I'm saving my antibiotics. I don't let the bacteria get smarter and become resistant.
Right.
Now let's talk about viruses. Well, Jason, how does preventing viral infections help? It's kind of hard. You know this better than me. It's kind of hard to determine if someone has true bacterial pneumonia or not, right?
Yep. Ear infections, viral ear infections.
Right, exactly, right. All this stuff matters. So if
Yeah.
you don't show up into the wonderful Dr. Mathis' clinic, not saying you shouldn't go to him when you need to, but if you don't show it, it makes it a lot easier for all of us. If you don't have to go be seen because you have runny nose and cough, well, that's where the vaccines help. You're preventing infection completely, so then it's easier, and then it's not, now we're not fighting for stuff. Do I have to treat you with an antibiotic or not?
Yeah.
I've now prevented something that now makes the world better beyond just making your child better.
Understood.
Now that's
Still
hard,
Come into the office.
but it's still coming up. Now, but then the last point would be, you got to come in to get the vaccines, man. That's
There
right.
we go.
But the
Full
last
circle.
thing is antibiotics have toxicity, right?
Right.
You can get rash.
Yeah.
You can get stomach ache. You can have diarrhea. You can have all these things that is well known to happen, maybe up to 25-30% of the time. That can happen. So if you don't need them, don't use them.
And you know what's funny is you bring that up, right? Is that, amoxicillin and common antibiotics can, in rare instances, can cause really bad, reactions to it.
Yeah.
Really bad, Stevens-Johnson, some just really severe reactions.
They're not benign. Bactrim is a prime example.
Right.
recently they've noted that Bactrim used long-term in conditions you don't need it could cause bad lung involvement to where you need lung transplant.
Yeah. So it's and once again, right? We talked about living in an environment where we're coexisting with a lot of these things that viruses, bacteria, some of the bacteria that we need. So we're altering, our environment, right? The gut, the microbiome, right? How these interact, and we wind up making other issues and leading to other bacteria. I mean, C. diff is a big one, right? Too much antibiotics for a particular, you throw off that whole balance. But you know what? I think I have kept you here long enough.
Oh my gosh, I could talk. I'm just afraid all these guys are like, man, are they going to stop? But I mean, I could talk all day on this stuff.
I think
it's a tremendous honor to be here.
No,
honestly,
listen, I appreciate you coming in here to talk to us. Coming down here to where? Where'd you come down to?
Gal Police, baby, let's go.
Okay.
Dude, that was tough, and I wasn't ready for it.
Were you a little nervous?
You were a little nervous?
No, it's okay. It's okay.
But I crushed it, right?
Yeah, you did. You did a good job.
Thank you. This time.
He did okay. I hope that this is one of many
I hope so
instances that we can really do more. It's about reaching out to the community. It's not just waiting until they have a problem or something. It's about reaching out to everyone because we are a part of the community.
That's right.
Right?
No, this is our community.
Right.
I might not live directly in Gallipolis, but look, I live close.
Right.
Not that far away.
Right.
Look, Gallipolis is part of my community.
Yeah.
1000%.
Yeah.
And I'm here when you need it.
I just lastly from on my part, the services and the help that you may one day need is only going to be as effective as what you put into it today, now. So I think we have to start somewhere. We have to have the communication. We have to talk. We have to build together. And I think this is step one of many, but it's step one.
Love it. Thank
you so much.
Thanks for having me.
Thank you.